I was drawn to neurosurgery initially because I had not just a fascination with the neurosciences, but I also really enjoyed working with my hands and looking for a way that I could blend the two to really help. After I finished my neurosurgery training, I went on active duty and spent 10 years as a neurosurgeon in the Army. I had the privilege of treating soldiers and their families, including their children. As I went through residency, it became very clear that I especially enjoyed working with infants and children. I really enjoyed working with them to allow them to be the best that they could be, and to partner with their parents to really help their children navigate what are some very, very challenging diagnoses. Neurosurgeons treat surgical diseases of the brain, spine, and peripheral nerves, as well as their supporting structures, such as the skull and the vertebral column. In children, there are a wide variety of conditions that we manage. Spina bifida, hydrocephalus, which is water on the brain. We also manage children who have had trauma to the brain, trauma to the spine, as well as tumors and diseases of the blood vessels that supply the brain and the spinal cord. One area that has really evolved over the last several years in neurosurgery in general is the addition of an intraoperative MRI. At DiMaggio, we have that, and allows us to do a surgical procedure and then immediately scan the child after the procedure is complete within the operating room. And if anything more needs to be done, we can then continue the operation, and we can combine that in some cases with advanced computer systems to navigate complex areas of the brain, as well as minimally invasive techniques to really take a surgery and make it as precise as possible, as minimally invasive as possible, and as successful as possible. When I see children and I see families, I really feel like I need to take care of not only the children, but the family as well, because we're all in it together.